SAGES Stories.
Welcome to today's episode of SAGES Stories, the official podcast of SAGES, the Society of American Gastrointestinal and Endoscopic Surgeons. Please make sure to hit the like button and subscribe so you can stay up to date with our most recent episode. And enjoy the show.
Welcome back, everyone. This is the inaugural session of SAGES Stories, where we shine the light on SAGES' most impactful leaders. My name is Dr. Kevin El Hayek.
And I'm Dr. Shirin Towfigh. Today's guest on SAGES Stories is Dr. Horacio Asbun. Dr. Asbun, thank you so much for spending time with us today for the first episode of SAGES Stories. We're so excited to launch this podcast, and we couldn't think of a more fitting first guest.
Shirin, Kevin, a pleasure. Thank you for having me. It's really a little bit of an honor, actually a big honor, to be in this episode, which is the inaugural episode. I'm very excited about it.
Well, it is our honor to have you on today's episode. Many of our listeners will know you as a dear friend. Most will know you as the recent immediate past president of SAGES, and it would take up the balance of our time to talk about all your other accomplishments in the work you have done in the fields of minimally invasive and hepatopancreatobiliary surgery. But suffice to say that Dr. Asbun is a living legend, and we are truly honored to have you on the show.
Shall we call you Horacio or Dr. Asbun?
Of course, please. No, call me Horacio.
Horacio,
Thank
maybe
you.
you can tell us a little bit about yourself, where you're from, what are some key moments that led you to being a surgeon?
I'm originally from Bolivia. I was born in La Paz, Bolivia. And my childhood up to 16 years old were there. And then I moved to Chile, where I did my medical school. In South America, medical school is 7 years and it's directly after high school. Then I entered medical school in Chile, and I was there for 7 years. And then I moved to Spain, where I did a postgraduate fellowship in surgery in Barcelona. And then I moved to the United States, where I did research, surgical oncology, and my whole surgical training. How did I decide to look into surgery? You said, well, why did I think about surgery? I actually was talking to Kevin the other day by coincidence, and I was telling him that I actually thought, what a pity I have to go through medical school to become a surgeon. I loved surgery even before I entered into medical school.
Mm.
Yeah, I mean, just traveling like that, going across the globe and landing in the United States, you must have just been exposed to so many different ways of doing things in medicine. So who were some of maybe your early mentors or people that impacted you along your journey?
Well, the first person that comes as my mentor is my father. He was a surgeon, but above all, he was a great human being. He was one of these people that has an aura when you're around him, and several sorts of people loved him. And I grew up with that image. But I always said I was not going to be a physician because I thought he worked too hard. He did teach me a lot of lessons about life just by showing me what type of physician he was. But there was an event that happened. My older brother that was medical school in Oxford died, and that's when I started thinking about becoming a physician. And my father did not want to influence me and never pushed me to be one, but I decided, and I'm very happy I did. Then in terms of mentors, he has been really the main mentor, even though it was my own father. After that, my career, because I moved so much, I have several mentors that have been influential in a particular spot, but I don't have an overall mentor that has followed my career for several years in the typical sense of the word. I am extremely grateful to many people that have touched my profession in ways that I was able to learn from them, and really learn the good and the bad, because some of your best mentors are the ones that show you what not to do too, right? I mean, they're not your mentors, but you get you become a mentee of them just by not liking what they do.
No doubt.
That's a great story. As a parent, I'm sure that your father wanted you to be a surgeon. There's a lot of stories about, or actually studies about, children of physicians, children of surgeons, and whether they should or should not feel like they should go into surgery because they've seen their parents work so hard. You're a father now. How did you kind of work with your children and show them what it's like to be a surgeon, and how has that been similar or different than how your father kind of framed your love for surgery?
Obviously, I learned a lot of the of how he handled a son that wanted to be a surgeon from him, but our personalities were different, and he had more of a traditional, typical surgeon's personality, loving his family, but very strong, right? I mean, the typical, usually right, sometimes wrong, but never in doubt. And I have a little bit of a different approach. Then he never want to influence me. In fact, I did my first appendectomy when I was 19 years old, because I had been in medical school since I was 16 and 17, I would say. And I was assisting in surgery, especially during my vacations. I was the second assistant. His fellows, after having assisted in several appendectomies, sneaked me in the operating room one day and told me, "You're doing the appendectomy today." I said, "What?" "Yes." I said, "My father is not going to like that." I said, "Your father is not here today." And I did. They had brought cameras. I still have the pictures. And I was so excited. I did 2 appendectomies in a row. They told me, "Well, why you don't want to do it? I mean, haven't you assisted enough?" "Yes." "You have assisted in over 30. "Yes." "And what are the steps of the appendectomy?" I tell them. They said, "Well, go ahead and do it." Then I was extremely excited. When my father found out, of course, he was not upset. I think he was elated, but he would never say that, right? It's a different generation. I learned a lot from him. Now, in terms of what do I did with my children, I never pushed them to be anything other than what they wanted to be, but I definitely pushed them to excel at what they do. Doesn't matter what it is, but the 2 conditions were like what you do as much as you can, of course, well, within reason, and at the same time, try to excel in it. Don't be mediocre in anything you do. It doesn't matter. If you want to shine shoes, then that's fine, but do it the best way you can do. And one of my sons wanted to be a physician since he was a little kid, and he's now finishing his surgical subspecialty.
Wow, that's amazing. So that's the 3rd generation of surgeons in your family.
Yes, but I call him the improved version. I call him Asbun 2.0.
Oh, that's great. That's fascinating that you were already doing appendectomies at that age. I'm presuming those were open appendectomies. Is that right?
Oh, yes.
Yeah.
Yeah, absolutely.
And when did you choose to focus on minimally invasive surgery?
Well, I was very fortunate. I was in a residency program where one of my senior residents and I liked laparoscopy, and when we used to reduce hernias, we used to put a laparoscope through the opening to make sure that the bowel that we had reduced hadn't died. And he had heard about laparoscopic cholecystectomy. He had graduated back in 1989, and he called me. I was still a resident, and I tried to join the 2 people that it's sad, but the majority of surgeons today don't even know their names: Eddie Joe Reddick and Douglas Olson.
Mm-hmm.
They were 2 private practice physicians that had started laparoscopic cholecystectomy in the United States, with Barry McKernan too at the same time. But Eddie Joe Reddick and Douglas Olson were the ones that really popularized laparoscopic cholecystectomy. Then I called them, and they were really booked. Eventually, Douglas Olson called me and told me, hey, you're a resident, right? Yes. I mean, why do you want to just come on a weekend? Why do you come to rotate for a month? I said, what? Yes, just come for an elective month. And I went as a resident to learn laparoscopic cholecystectomies in 1989, actually. And that was fascinating to me. And I've been very blessed because that has driven my career. And I could never believe that at that time that we were going to be doing what we're doing now. It's fascinating. That has kept me very passionate about what I do, and has basically allowed me to make tons of friends around the world.
Those roots are so important. So this is Dr. Reddick and Dr. Olson of the Reddick-Olson instrument, correct?
That is correct. There are several instruments, but the funny thing is, because they were private practitioners, and the way how they were doing the courses was not well received by academia. And academia were right, because what happened is a lot of people tried to make tons of money doing courses on a weekend. But Reddick and Olson did it, I think, a little bit better than what the majority did. And Eddie Joe Reddick used to tell me, I don't know why people are so upset because I'm charging. I'm not an academician, and I don't charge to the people that are in my town. But if people wants to fly to see me, why am I not going to make money? We're in the United States, and I promised my wife I was going to retire by 45 years old. And he was at the laser booth in the American College of Surgeons and getting significant amount of money for being at the booth. Then all of those things were not well seen. And yes, there were a lot of bad things that happened during that time because it was the Wild West. Nevertheless, there were a lot of good things too, because thanks to them, there was a revolution that changed surgery.
Absolutely. And we already shared our stories behind the scenes about when we first got our membership to SAGES. When were you first a member of SAGES?
It was interesting because Eddie Joe Reddick, when I was a resident, I was rotating with him, and he told me, listen, you need to join this society. And I said, but this is endoscopy. He says, no. This is a brilliant group of people that are innovators. This is such a cool society. It's not that big. This was 1989, but somebody like you really need to join this society. And I said, well, I don't know anybody. You said, just join, you'll do well. And I did, 1990, I think, or something like that, 1991.
And then you ultimately decided to narrow your clinical practice into hepatopancreatobiliary surgery. What made you kind of go that route once you were making the decisions on what to focus on clinically?
Well, it's all the opportunities that they present to you. I'm a believer that everyone has opportunities. You just need to take advantage of the ones that you are offered, as long as you like them. Then I had taken laparoscopic surgery. I was in the top of the world when I was 31 years old, finishing my training and being one of the few people that had the experience in laparoscopic cholecystectomy that I had, because I went back to my residency program and I taught my residents, my co-residents, I taught my attendings and everyone how to do laparoscopic cholecystectomy. And that was a gift, right? I mean, as a resident, to teach your attendings. And then I had several job offers, etc. But then I realized that laparoscopy was just going to be generalized. It's not a specialty as laparoscopic cholecystectomy, because everybody was going to do it. And I was always attracted to pancreas, liver, and endocrine surgery. And I applied to a fellowship because I realized I needed to have a higher skill. And then I did a lot of other advanced surgeries through the laparoscope. And it was a fascinating time on the first years of my career, because for the colorectal surgeons, I helped train a lot of colorectal surgeons. Then I learned colorectal surgery and so on.
And how did your group take it? Because in my town, when laparoscopic cholecystectomy became introduced, there were surgeons that lost their privileges at the hospitals because they felt that it was, almost malpractice to do this operation when you can do an open surgery, and there were so many injuries from bile ducts that were reported with a laparoscopic approach. This is very, very early on in that in kind of laparoscopic world. So were they all open to what you were doing, or did you have to fight
No,
your way through?
no, I had to fight my whole way through,
Mm,
especially when I was doing advanced procedures.
mhm.
But rather than talking about me, because I've been talking a lot about me, let me tell you the story about Eddie Joe Reddick and Olson, how they started. Because at that time, Barry McKernan had done one like 2 weeks ago. Apparently, they got together and they planned how to do it. And Barry McKernan had done one with Bill Say, who was a GYN doc. And then Eddie Joe Reddick and Olson had gotten together with a GYN in Tennessee, and they planned the first ones. Then Eddie Joe Reddick had what, as I understand, I think 8 patients lined up. And after he had done 2 or 3, the hospital where he was, they say, you cannot do this. You definitely, there's no track record for this. And they
Right.
wanted to stop him from doing it. And all the other surgeons wanted to stop him from doing it. Somehow he convinced the hospital administration, listen, let me finish the ones that I already have scheduled, and I promise I will stop. He was a very smart guy. Then they said, okay, after you finish these 5 or 8, I don't remember, but it was less than 10, you stop, you promise, yes. Then he finished the 5 or 8, and then they took the privileges out to do laparoscopic cholecystectomy, and they said, you cannot do them anymore. But then he had 8 that had done fantastically well. He went across the street, literally across the street, to the smaller hospital, that was the competitor hospital, and was much smaller, and said, listen, I'm willing to move here if you let me do laparoscopic cholecystectomies. They showed the 8 that had done fantastic, or the 5, I don't remember. And all of this started this revolution started in a very, very small hospital that was across the street, the competitor from the initial hospital. And this small hospital had, for the next 2 or 3 years, surgeons flying from all over the world to watch. And it was fascinating. I was involved because after I rotated a month, I was very fortunate. They invited me to be faculty of their courses. And while I was at the residency training, I flew every other weekend, because at that time we were every other weekend on call. Then the weekend I was not on call, I flew from California, or they flew me from California to be faculty. I mean, I'm saying faculty, but I was just at the pig station to guide the surgeons how to do the gallbladder. Then I called myself faculty at that time, but what faculty? I didn't do anything other than just teach them there. But it was fascinating. I saw a very interesting transition of the people. The first group of people in the early 1990, 1991 were 2 types. Either the surgeons that had failed and wanted to look for a gizmo to really succeed, or the surgeons that were visionaries and very early on realized this thing is going to be really good. Then we used to laugh about, say, okay, who's going to be the bad one that just trying to get something new, and who's going to be the visionary? Then in the middle, in the subsequent time, there was the middle group. The middle group were all the majority of the surgeons that wanted to learn, and were the average good surgeons that wanted to learn. And a lot of the good academicians went through it. And to me, I couldn't believe these big names that were on my pig station. And I obviously no one knew me at that. And then at the very end, it was interesting because there were the disgruntled surgeons that were very upset that this thing had really been successful. And they had been blasting laparoscopic cholecystectomy for a year and a half, 2 years. And now they found themselves that needed to learn. And those were really unpleasant because they treated you very bad. They didn't like it, but they were forced to learn. It was a whole transition.
I think the story of the laparoscopic cholecystectomy and just the revolution that brought on has continued, and in many respects, one of the great features in surgeons who continue to be part of that innovation is the ability to adapt as new things come along, but also to recognize which things should keep and which should be given away. and let go. What is something you're doing now, or what's an operation you're doing now that didn't even exist when you were in your training?
Oh my God, are you kidding me? That there are several, and that's the beauty of it. The beauty of it for me. We have done so many things. And when I say we, I'm not talking just about myself. It's a group of innovators. For example, on HPV, what can I tell you? Something that I started doing when I was at Mayo Clinic is separating the duodenum from the pancreas to do pancreas preserving duodenectomies. And it was fascinating to first realize that we could do that. And second, to see the duodenum connected to the pancreas just by the common bile duct, that you could see it from behind entering the duodenum. I distinctively remember when we did that procedure, a total duodenectomy, on a patient with pancreas divisum, we saw 2 ducts going in, and we knew the patient had pancreas divisum. And the first time we were looking with my assistant, and we were saying, oh my God, because we realized that the Santorini was the main pancreatic duct, as you know, and the common bile duct with the versum were coming out of a crevice, and where on the other patients, the pancreatic head was really smooth. And we realized that crevice represented the failure to fuse the posterior bud with the anterior bud of the pancreas, meaning the embryologic reason of the pancreas divisum. And we have never seen or understood that other than, what they tell you on the embryology classes. And to see that, we were so at awe that the scrub nurse keep telling us, what? I don't understand. And then she said, you guys are such a nerds. I mean, why are you so excited about this? What I see there is just pizza. Why are you so excited about it? And we laughed, and the things like that. I mean, the first time I did a laparoscopic Whipple in 2001, I think, or 2000, was crazy.
Yeah.
I mean, we couldn't believe the things. I mean, you have to remember, when we started cholecystectomy, laparoscopic cholecystectomy was the perfect procedure to start, because everything goes in one direction, right? You don't have to move around. Everything goes to the right upper quadrant. Then if we wanted to go to the lower quadrants, we wouldn't even be able to do it, expeditiously. We would get disoriented, because everything we learned just going in one direction to the right upper quadrant. Little by little, we learned to the point that we did what we did. But there was a lot of fights, a lot of arguments, a lot of people when you stand up and present trying to put you down. There were hospitals that they review not only the laparoscopic cases, but every single case I did. They were trying to find out, how could they find something to get me? But I don't take it personal. It's normal, because there were so many complications by surgeons that were not prudent in what they were doing. And Kevin, I would make a mistake if I don't say what guides a surgeon that's doing innovation to be careful and not to forget that we're dealing with patients, right?
Sure. Yeah.
Because we get so enthusiastic, and particularly when you start to get invited to give lectures and show, and you see that people are so enthusiastic about it, that it is very dangerous. You can forget that maybe you shouldn't be doing something new, right?
Yeah.
Then very early on in 1991, when I started to do other things other than laparoscopic cholecystectomy, I started to feel, how do I know this is going to work? How do I know that I should be doing this? Because we saw a lot of complications. And what is it driving me to do it? Innovation, of course, helping the patient. But I thought, am I in a conflict here? Because is this really going to help the patient? Or am I trying to convince myself that's going to help the patient because I really want to do it?
Yeah.
And it's going to sound cliche, and maybe you have heard me say this before, but the simple principle that has guided me my whole career has been, would I do this on my sister? And that's, of course, you need to think on a sister that you like, of course.
Yes.
But really, would I do this on somebody?
Yeah.
That's correct. Would I do this on somebody that I love? And that is such a simple statement. But really, if you practice it in everything you do, you're going to realize that the way how you practice may be very different. As an example, many times we're in surgery and the procedure, let's say pancreas, right? I do, and you think, well, this tumor is going to be very dangerous to take it out. I think I'm just going to back out. And then you think, why am I backing out? Well, because it may bleed. I may, have a complication. I'm going to have to present in tumor board. I mean, in M&M. If the patient has a bad complication, I may get sued. But then you think, what would I do if this is my sister? Would I back out? No, I would just take the risk and do it. And then all of a sudden, you forget about the lawyers, you forget about M&M, and you say, if this is my sister, I would do it. Why am I not going to do it?
What do you tell your graduating, or I was to say senior surgical residents, about the future of laparoscopic surgery, and how do you motivate them to consider that as a specialty?
Well, I think that you motivate by example, Shirin. I think if you try to convince somebody to do something, it's always like you're trying to sell something. But if you show, it's just to encourage them. You just have to show the greatness of what you're doing. I mean, not because of me, but because of the specialty, and try to see to show them the fun of it, being realistic, because you go through a lot of hardship anytime that you do surgery of high complexity, but at the same time, show them the rewards. I show them, why do you do that? More than anything, I tell them, just make sure, again, you choose something you like and you're good at it. And don't ever forget that as the Mayo brothers said, the main interest at hand is the well-being of the patient.
So we all affectionately, we love SAGES, and we know that this year and your presidency was marked by radical changes in the way the society is run, in all societies in many respects. What's one takeaway from running a society during a pandemic that you would share with us?
I'm pausing because I've been humbled by it.
Mm-hmm.
And I have learned so much. I've been very fortunate that I'd receive a lot of kudos and a lot of compliments about SAGES this year, but I received them with a strong sense of humbleness. I think if I could say a single word, is adapt. Life is a series of adaptations, and I could never say that as strongly as this year. When I started, we had Aurora Pryor had done a tremendous job on the first weeks of the pandemic, and all of a sudden it was falling on my lap, and you have this sense of strong responsibility that the reality is you need to trust that if you are placed on that position on a society like SAGES, you must have the staff to be able to lead SAGES. And I say that because one of the main things when you become a president of SAGES, and I have heard this in the majority of the presidents that I have worked with, is I'm humble because you think that I am now part of the group of people that are able to lead a society like this. Then I thought to myself, they trusted me. Then I must have the stuff to do it. Then just forget about it and do it. Then one of the main things I did at the very beginning is I am very fortunate. I have a big group of friends internationally, and I started calling them just as a friend. I distinctly remember Andrea Pietrabisa, at that time president of EAS. I gave him a call. Hey, how is Italy doing? And he said, listen, I left Friday. This was Sunday. He said, I left Friday. Everything was good at my hospital. And they called me Saturday and Sunday. We have had a horrendous number of patients. We didn't even have one. And we're canceling everything. Wow. And to see the distress on his voice. And then on subsequent conversations with my friends in England, in France, etc., I started learning how difficult it was for them and for us. We hadn't even heard of. We had heard of it all. I distinctly remember I learned about the lack of smell, the sense of smell and taste, when I was talking with one of my friends in Switzerland, and Nicolas de Martins, and he was telling me, listen, you really need to be careful. Our ENT doctors are dropping like flies because they are having these patients that, because they have anosmia, and we never knew that the virus was causing this, and we now know it's a presenting symptom. That was corroborated with the people in Spain and again with people in Italy. And at that moment, I said, we really need to be prepared for this. And we created a big international group that we call the Coronavirus Global Surgical Cooperative. Obviously, with SAGES support, we met every week and we were able to do a lot of the communications. We expanded what it had been started the first week with Rory, and we were very successful. And that I was just doing it, not even thinking what the implications of it were. In similar manner, you start to attend, different areas of the society. You start to comparing notes and sharing experiences among different areas, not only around the world, but now in the United States. And it was interesting how to see our friends on our Zoom calls with their faces in Europe first, and then how that transitioned. And then they were a sense of hope to us when Pat Silla in New York, that was part of the group, you saw her now on these Zoom calls, very desperate and frustrated, handling it in an amazing way, but with the faces that we had seen our Italian friends. And then we could tell her, listen, look at the Italian friends now. They have overcome this. It's past. Then it's gonna arrive. We're gonna be able to do that. Then the sharing of those experiences was fantastic, and we're starting to interact with industry, as you know, to deal with the insufflators and the spreading guy in the operating room, et cetera, et cetera. And it became a fascinating experience. Being the president of SAGES, especially at this time, humbled me the most for the following reason. When you are in the early ages, you see the SAGES machinery, you think how fantastic it is, you hope that maybe one day you could be part of it, then you go through the leadership, as you two are, and you see all the great stuff. But when you become the president, you see it all together. Mm-hmm. And the fascinating thing is you are now not doing all the things that everybody else is doing, just overseeing and giving the ideas and working extremely hard, but you have the appreciation of what I will call the wonderful people of SAGES. I've been humbled by the executive committee members, by several of the board members, all the things they do, and now you know how they do it because you have to oversee them, and you are on top of everything else that's happening, and it's just amazing. You get humbled. We have brilliant people, and that's why SAGES is so entertaining, because all of us have passion about it, and we do it in a way that passion is spread to the people that are around us, and hopefully SAGES is going to be able to keep that as new generations come. I trust that we will.
That is so true. And now, 1 year later, we're having our in-person meeting in Las Vegas. Our SAGES annual meeting will be August 31st through September 3rd. I will be there. Kevin will be there in person. And I understand there will also be a virtual component, our first meeting since the pandemic. So what can the attendees expect for this year?
We will be meeting in person. What a gift.
Yes.
Come on.
Yes.
You know,
Yes.
after
Yes.
having all this last year and a half
Oh my,
without
yes.
getting into this, we will be meeting in person, and that by itself is going to be fascinating. Precautions have been taken of how things are by August, but the reality is things are looking up very well, and we probably are going to be able to do a lot of the normal stuff that we normally do. I hope our friends from Asia and even as close as Canada are going to be able to come. South America is not as good as United States right now, but hopefully things are going to improve. And if they don't for them, they will have this this virtual possibility to join us. Having said that, the program is superb. I was very lucky to have Adnan Al-Saidi and Dana Talam accept my offer for them to be the program chairs. They have an amazing program. They have put an amazing program together. I'm not exaggerating. I think it's going to be a fascinating way of displaying all the capabilities of SAGES. And we know it's going to be probably with some difficulties, because I'm not sure how many people are going to be able to bring their significant others. But it's going to be the first strong step to go back to normality. Then whoever is going to listen to this, you better come and show yourself in person.
So for this next segment, we've affectionately called the We Are the Sages segment in honor of our annual sing-off, which hopefully we will all be at again this year. We'd like you to share your most memorable SAGES moment.
We are the world. We are the sages. We are the sages. Sing it, everybody. We are the ones who make it bright our days. So let's start treating.
Oh man!
Right.
Wow, it's
Or maybe a memorable one.
There are so many. It's obviously my position is when you learn you're going to be a president, it's extremely memorable.
Yeah.
But as important to me was when I was an unknown entity, and I didn't know how to become a member of a committee in SAGES. At that time, it wasn't like now that you can self-nominate and it's much more open. I didn't know what the mechanism was. I was very young in my career. And I remember there was this guy that I learned had done a fellowship at Leahy Clinic. And he had treated me well when he saw me, Dan DeZiel. And Dan DeZiel had always made me feel that he cared about me, even though I was a nobody in the conversations we had. Then that gave me the courage to approach him, to ask him, how do I become a member of a committee at SAGES? He was high in the leadership by then. And he just laughed and said, it's very easy. You just tell me and you're going to get one. And guess what? I know the committees that you're going to be good at it. Then he put me as one of them in the Education Resource Committee. And that was the start of me getting into the leadership. And just to see somebody that cared and put a person that had no, no mentor to be guided within the SAGES group, it was great. It was fascinating. And then I always say, I didn't have a chair that guided me to be a mentor. I didn't have a group, but I had a whole SAGES. Those were my mentors. You guys are my mentors. I learned from you. I
Well, you're
learn
our
from every
mentor now.
person.
You've stepped in.
You
The
know?
reason you don't have any mentors anymore now is because you're the mentor now.
No, it's fascinating. We learn from each other.
Yeah.
You know, and I am very fortunate because I think I'm living proof of the fact that if you work hard and you're interested, you can go through the ranks and become president of SAGES.
And just because we're having fun, what was your craziest, funnest memory from a SAGES meeting?
Craziest, funniest moment. So many, but
Yes.
let me tell you one. On my early meetings, I think it was New Orleans or something like that, and it was before the first sing-off. And at that time, I had been at the American College of Surgeons and all of those meetings. I was very young. All of a sudden, I'm walking down the streets and I see these professors of surgery that I grew up, remember, on a very hierarchical, culture in surgery, right? Europe, South America, etc. And I see all of these professors of surgery that were on their suits during the day and giving incredible lectures that had my jaw dropped, thinking, oh my God, what they do, I want to learn. All of the sudden, I said, they cannot be here. They were dancing like crazy and singing, and then they did some karaoke or something like that. And I was thinking, what a cool society. I couldn't believe it. And little did I know, the next day was the sing-off, and I saw all of them, not just the ones that were dancing on the disco. Then, the sing-offs can become really crazy, but crazy in a good way. I think that there are several moments. It's difficult to say one. It's just a fantastic society, and I keep saying it not just as an advertising. It's truly what I feel, and I think you all have similar feelings.
So Dr. Asbun, this has been an amazing time with you. We love all the stories you shared, truly inspiring. Thank you again for joining us today. We can't wait to see you in person in Vegas at the annual meeting. That's August 31st through September 3rd at SAGES 2021.
Kevin and Shirin, thank you for having me again. I said that at the beginning. It has been a pleasure. This is more than an interview. I feel I just was with friends that had made me feel special and allow me to talk. And gosh, I can talk. You just saw that.
Now you know why we chose you as our first guest. You
I
made it easy. You made it easy for us.
I hope is what you like, and hopefully people are going to be entertained. I'm humbled by it. Thank you very much again.
And that wraps up today's episode of SAGES Stories. You can view the show notes for additional information mentioned on the show. Also, please visit sages.org for membership information and for the most recent news from our society. Follow us on Twitter at @Sages_updates, and make sure you hit the like button and subscribe so you don't miss any new episodes. Tune in again next time, and remember, you can't spell minimally invasive surgery without SAGES.